So far we were talking about the demand. When we started, we said we started with the demand for health, right, and we said health was a stock commodity and we called it the stock of health, and then we said healthcare was an input for developing this stock of health. So, we developed it into a production model where we considered healthcare to be an input, correct. And then we talked about different things about this health as a product. We said you could distinguish it into 3 kinds of products, and the Grossman model specifically was distinguishing it into 2 products, and it said 2 kinds of products, and then it talked about the different how the different factors influencing the life of an individual, how that can influence his investment on healthcare and hence his health stock, right. So, all that we have covered. Now, today we are going to specifically talk about, so we are going to go back to that first point where we started, where we said okay, demand for health and healthcare is an input, or healthcare is something that is used for improving the health, and it is necessary to improve health because you get some utility from that health stock, and also because that health stock depreciates over time. So, you need to repair or maintain it, and at the same time you may have a desire or a benefit from having a better amount of health stock. Now, today we are specifically talking about that input, healthcare. So, we have talked about that input, healthcare, in terms of how it can be used, and based on what what leads to an efficient use of the input, what leads to an inefficient use of the input, for example, wage rate and education and all that. But today we are just singling out that input, healthcare, and we are going to talk about the market for healthcare. So, we are talking about the primary market for healthcare. Now, what do I mean by the primary market for healthcare? Now, as you can understand, this good healthcare, this good or service healthcare can have different dimensions, right. For example, medicines can be considered as healthcare, physicians can be considered as healthcare, dentists can be considered as healthcare, nurses can be considered as healthcare. Among nurses, you have different categories of nurses. So, basically you can have different goods and services which can be included under this medical care or healthcare input, right. So, today we are just not going to go into those splits, we are not going to look at them in isolation, but we are considering healthcare to be one big product. Okay. So, remember that we are talking about healthcare as an input. So, healthcare is still an input which is used to produce that output health stock, but in today's discussion we are talking about the market for this healthcare. Okay. So, as soon as we talk about market, what comes to your mind? What is market? Buyers, in a place where buyers and sellers interact. That means now we are talking in terms of the demand and the supply forces in terms of healthcare, because market means buyers and sellers. Buyers means they come to the market with a demand, the sellers come to the market with a supply. So, as soon as we talk about any market, we are talking about the demand and the supply forces that exist with respect to that commodity or service. Now, the next thing is, so we basically have an understanding of what is a market from basic microeconomics. What is a market, what a market diagram looks like, or what is the demand or a supply of a commodity, or how they react to the prices in the market, right. All of that, or how it reacts to non-price factors. So, we are not going to go into those details. Those things will still be the same for any market. For any market, the demand depends on those same price and non-price factors, and the supply depends on those same price and non-price factors. But we are going to differentiate this healthcare market with any other market, any other market which is called a free market. Why are we calling it a free market? Free, there is no government intervention. That means the demand and the supply forces in the market itself can bring the market to an equilibrium. So, if you consider the market of any commodity, if it is not a special commodity, okay, if it is just any random commodity like potatoes or flowers or chocolates or ice cream, anything that you think about, okay, all those markets are usually free markets. okay, in the sense that there is no government intervention on a regular basis in those markets. However, if I consider a market for, let us say, marijuana, right, in certain states there will be government intervention, because there will be restrictions that, okay, for these needs it is legal, for those other needs it is illegal, and things like that. So, here we are talking about the commodities. When I say free market, I am talking about commodities and services that can be demanded or supplied without regular government intervention. Okay. Now, does that mean that a free market or a market of this kind does not ever fail? No, that is not true. Even a free market can fail. For example, I can have a market for potatoes, and if there is a big, some drought in United States, and the drought continues over a period of several, months, and for whatever reasons the cold storages in United States do not have enough stock of potatoes, there might be need for government intervention, as in the government might want to import potatoes from some other country, because potato is a very staple kind of food for Americans, right. Or the government might do something to kind of put the prices, to bring the prices down in the market, because whenever there is a shortage in the market, the prices go up, right. So, the government may intervene. So, what I am trying to say is, even in a free market there may be market failure, and hence government intervention may become necessary. Okay. That is why we are saying without regular government intervention. This is not a regular phenomena in those markets, but those markets can still fail, and government intervention may still become necessary in such markets. Okay. Please be clear about that. So, now what we are going to do is we are going to talk about how is the healthcare market different from any of these free market, or in other words, in terms of your exam, the question that I am heading at is, how is the healthcare market different from the market of any other commodity? Okay. Now, please do not confuse this with the question that we discussed yesterday, that how is health different or similar to any other commodity, right. There I was talking about health, that means the stock of health, remember, or I was asking you how is healthcare different as a commodity. How is healthcare different from any other commodity? That means I was talking about the feature of healthcare or health as a commodity, and how is it different from any other good like ice cream or textbooks or whatever. Now, I am talking about how is this market different from the market of any other good. These are two different questions. Please do not be confused. Okay. 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 Now, in a free market, somebody wants to buy a good, obviously the person goes to the market with a desire and the ability to buy the good. The desire means the quantity decision, how much of the commodity you want to buy. The willingness or the ability means you have a willingness to pay, or you have a certain affordability in your pocket, means you have a certain amount of money in your pocket. If you do not have enough money, if you go to the market and you see that the market price is much higher than what your affordability is, then you end up not buying the good, right. And if you see that the market price is acceptable, that means your willingness to pay allows you to buy that good, you end up buying the good. It is as simple as that, right, for any other commodity. Now, please note that for any commodity, for any good that you see around yourself, you bear as the individual, the buyer bears the entire responsibility or the financial burden of his purchase, right. And that financial responsibility is immediate, as in you walk into Walmart, you buy a pack of pens and you tell Walmart, I am going to pay you after 1 month. You cannot do that, right. you buy it, you have to pay that money immediately, or Walmart is going to tell you, why don't you come back after 1 month and buy it, right. So, that means the first feature of a free market is the buyer has full financial responsibility, and that financial responsibility is immediate. You cannot defer that responsibility. Okay. Now, please note that here we are not talking about cases where you go to the market, you buy a pack of pens. We are not talking about a buyer who is probably a minor, a kid, he goes to the market and then he has his parents pay for the pack of pens. We are not talking about, those kind of exceptional situations. But usually, if you are a buyer, you have to pay for it, as in, the money has to go out of your pocket, correct? But if you think about healthcare, in many cases, the financial burden may not be with you, okay, and sometimes the financial burden may be deferred. Even if it lies with you, it may not be an immediate burden, correct? That means we are talking about a situation where a person may be insured and hence get the entire amount paid by a third party. So, there is an involvement of a third party, usually an insurance company, employer provided or a private insurance or whatever, and even if he does not have insurance, in many cases the payment could be deferred to a later time. So, the financial burden may not be immediate. I am not saying that it is not immediate all the time, but in many instances it may not be immediate. It can be deferred to a later point in time, correct. So, here financial burden may be shared, and secondly may not be immediate. Okay. Now, the second point that we have is that in the free market, when you talk about any good or service, in the first place, why do you buy that good? Why does a consumer decide to buy a good? If you want to eat an ice cream, why do you go and buy that ice cream? Why? 1%, please. Huh? Correct. So, it is a benefit and a cost decision, right. So, your buying decision is backed by your cost benefit analysis, because that is where we started in lecture note 1. We said any decision an individual takes, be it a buyer or a seller, he ends up taking a decision because he perceives of some benefit and he perceives of some cost that is attached to it. Only when the benefits outweigh the costs, then he goes and takes that decision. Similarly, for a purchase. If you want to buy an ice cream for $2, you think that, okay, from the $2 that I spend on the ice cream, the sweetness that I can taste, and if it is summertime, how good I am going to feel after eating the ice cream, that is going to give me higher benefit or utility, however subjective that might be, than the cost which is going out of my pocket, those $2. Correct? And hence you end up taking the decision of the ice cream. That means in your mind, although it is at a subjective level, you know the value of your consumption. You know the value of that ice cream, correct? Or if you are sitting in this class, you are consuming a service, you are consuming the service of an education, right? You know exactly what is the value of these 3 years, what this education is going to give you. You have weighed the cost and the benefit of this education, you decided the benefit is going to be more, and hence you decided to consume this service, right? In other words, the value is easily determined. It is easily determined. Even when it is a service, even when it is not a tangible good, even when you are consuming some kind of non-medical, non-healthcare kind of service, you know the value of that service. For example, in your house, if you are getting electricity, you know what is the value of that electricity. If you do not have electricity, there will be no heating in the house. You probably cannot cook, right. So, you know what are the costs and the benefits of that service that you are getting. Think in terms of healthcare. In many cases, in case of healthcare, the service that you are consuming or the commodity that you are consuming, that is not a tangible commodity in the first place, and secondly, it might be information. In other words, the commodity itself might be the information that you are getting. For example, let us say you go to the doctor's office. Most of the times, unless you know you are having some outpatient surgery or something like that, the doctor is not like doing some procedure, he is not carrying out any procedure on your body, he is just talking to you, right, advising you about things, maybe referring some diagnostic tests. That is what you usually do at a doctor's office, maybe taking some vital stats, talking to you about your health condition, and you know writing some tests for you, but not necessarily there is a tangible commodity or a service that is being transacted at that point in time. In other words, what are you consuming at that point? You are consuming information. The commodity is the information, right? And how do you determine the value of that information? Immediate. Is there an immediate value of that information to you? It is difficult to be determined, right? You are thinking that it will be valuable to you. You are thinking that that 1 hour of consultation from the doctor is going to benefit you by curing you of your illness. But there is, you do not know, you are just coming home with that information, you are not coming home with the cure. Do you see what I am trying to say? You are not coming home with the cure. So, there is a question mark attached to your consumption at that particular point in time. Compare it with the education. Let us say, God forbid, I do not want any of you to drop out of the program, but let us say, even if you drop out, you do not go all the 3 years, you go 1 year. Maybe you will not get the degree at the end of 3 years, but in this 1 year, you know exactly what value it has attached to it or what disutility it attached to it, right. What is the loss of 1 year, what does that mean to you in terms of money, as in opportunity cost, in terms of time, and in terms of any other disutility, like getting mental fatigue or getting burnt out, exhausted, not being able to be with your family, and all of that. You can attach a value to it. You can determine what exactly you lost. And similarly, the people who stay in the program after 3 years, they know exactly what benefit they got. Although please note, this is not a tangible thing that is getting transacted, even in the case of education. You are actually receiving a service. But what I am trying to say is that in case of other goods, it is kind of easier to determine what is the value of that good or what is the value of that service. Whereas in healthcare, there is a lot of ambiguity in determining the value of the service because the role of information is very big. There is a big or a significant role of information. Which makes determining the value difficult. Now, this is all relative, right? It is relative to any other commodity. Now, you can argue that in case of certain healthcare goods, I know exactly what is the value. For example, if I take a medication for, let us say, if I am taking high BP medication, I know if I do not take that medication for 2 days, my BP will shoot up and I am going to have a stroke. So, you know the value and the cost. But here we are talking about an overview. We are doing like a relative study compared to the other goods, okay, and we are considering healthcare as a universal product here. Okay. Now, the third point that we have for free market is the purchase of these goods which are traded in the free market, which are bought and sold in the free market. It is not a vulnerable purchase, and I will tell you what I mean by that. That means if I buy the good, if I buy potatoes, I know what is the use of potatoes and I know why am I buying it. I take it home, I either make mashed potatoes, I make fried potatoes or whatever, but I know that I am going to eat it and hence I am buying it, right. So, there is no uncertainty attached to it. If I have any very specific disutility attached to it, let us say it does not happen with potato, but let us say I am allergic to potato. So, the first time I will buy potatoes, if I eat it I will have some allergy, that means it is a major high disutility, the next time I will not buy it, right. So, the vulnerability is low. Do you see what I, yes Josh? No, we let me talk for 1 minute, then I think it will be clear to you. In other words, what am I saying? I am saying, so you value, of course, yes, I know what is the value of that potato, but at the same time I know with certainty that value, or I know with certainty the utility or the disutility for these commodities. Just like your education, you have a value of these 3 years, you know you will get with degree and you know that value with certainty. There is no, there is not much uncertainty attached to it. You know what are the career prospects of a DNAP versus somebody else who is in a regular nursing profession. So, your consumption is not a vulnerable consumption, there is less uncertainty attached to it. In the case of ice creams, you know there is a value attached to eating ice cream and you know with certainty what is that value. If you bite into the ice cream, you know for sure it is not going to taste bitter. You know it is sweet, you know with certainty, and it is for the sweetness that you are consuming it. Do you see what I am trying to say? But in case of medical care, in case of health care, most of the times when you purchase, since there is this role of information and the consumers are on the side where they have less information, that is why there is a vulnerability or there is an uncertainty attached to the consumption. So, here you have uncertainty, vulnerability or uncertainty. And please note that it is due to this uncertainty that you try to safeguard yourself against any kind of uncertain situation. Let us say you have fever, okay. This may not be true for many of you because you guys have a very strong background in healthcare. So, maybe when you have a fever, you know why you are having the fever, is it a flu or whatever, you know the symptoms because you are professionally trained. But say if it is for me, if I have fever, first I will try to have some regular over the counter fever reducer or just have juice and water and try to cure myself. If I am not getting cured, then I will probably go to the doctor and the doctor will run some flu test. Even then I do not know if I am having a flu or not. Let us say my flu test comes out negative. Even then I still have to pursue the treatment, go to maybe a specialist, even if I do not get cured, and maybe they will take me to, I will go to ER and get myself tested for all the definite, all kinds of tests like jaundice and typhoid and malaria and things like that, and see if something is wrong with me. So, each time when I am going, I am consuming the healthcare commodity, but there is an uncertainty attached to my purchase. I am purchasing it and I know there is a value attached to it, right. The value is that I am assuming that I will get cured of the fever, but each time my consumption still has an element of uncertainty, and that uncertainty is because of the fact that I am on the lower end of information. As a patient, as the consumer, I am on the lower end of information. That is why there is uncertainty. And it is because of this uncertainty that lies in healthcare market that we as consumers try to safeguard ourselves. How do we try to safeguard ourselves? We buy health insurance. We try to involve a third party who will take some of that uncertainty away, who will take some of that risk away, right. If I have a regular fever, if I have a fever, not regular fever, if I have fever, there is a possibility that the fever may get cured in 2 days just by having some OTC medicines, and hence I spend just $5 out of my pocket, or there is a possibility that this fever might continue for 1 month and I might have to run 10 diagnostic tests, and spend hundreds of dollars from my pocket. So, there is uncertainty, there is a risk, and since I want to insulate myself against that uncertainty or risk, that is why there is involvement of these third parties in the healthcare market. By third parties, I mean the insurance companies, right. Otherwise, there would be no need for insurance companies. When you buy ice cream, do you buy insurance for your ice cream? That if my ice cream falls from my hand, I will go and claim it from the insurance company? Does not happen, but you do it with cars because there is uncertainty. Yes.
So is the uncertainty just related to money because we don't know how much things will cost? Or risk?
It is risk, it is not essentially related to money, but it is related, we are kind of course, the losses in terms of money could be in terms of money or time, but uncertainty, we are kind of talking about uncertainty in the consumption, that when you consume the healthcare, there is an element of risk. Do you see? Or let us, a very simple example, and that could be true for all kinds of goods, but also it is very important in the case of healthcare because the consequences are much more severe. For example, you take a medication and you have never taken that medication, you do not know whether you are going to have any drug reactions to it, but you end up having a drug reaction which is life threatening maybe. In many cases that happens, right, for healthcare goods, and it may happen for other commodities also. That is why we are saying it is a relative study. We are not saying anything for certain, we are not saying that this is, this is a rigid thing and this is never going to be ruled out, but we are trying to say in terms of when you compare it with other commodities, that uncertainty element is more in the case of healthcare. Or let us say the quality of the service. You go to a physician, you do not know what quality of service you are going to get from the physician, right. If you go to let us say Macy's, you know it is a brand, you know exactly what kind of goods you get at Macy's, right. You see a brand, you say you want to buy a t-shirt, you buy Adidas or you buy some company t-shirt, you know that it is a brand. You may have bought it earlier or not, but you can read the information. There will be some information given to you that this is safe in the washer and you can wash it at home and this is 100% cotton. So, you buy it based on that information. You go to a physician, he may have a degree, an MD, but you do not know what is the quality of the service that you are going to get. He comes with a tag, he is MD, but all MDs do not give you the same kind of service. Do you see? So, there is a higher element of uncertainty that is attached to a healthcare good relative to any other good. Now, you can think out of the box and you can see exceptions in both cases, but we are just trying to do an overview here. Okay. Now, the fourth point basically kind of follows from the third point, and I think we kind of covered the fourth point in the third point itself, that here you do not have much cost sharing, cost or risk sharing, or limited, let us not write, no, limited and since there is uncertainty here, you try to involve third parties for the cost or risk sharing. Third party payers are involved. Okay. Now, since here you do not have much cost sharing here or you have limited cost sharing here, that is why, and also following from the fact that the most of the financial responsibility lies with you, here you have a self ration on the consumption. There is a self rationing of the consumption, as in you do not want to over consume. In the free market, there is a self rationing process, because the entire financial responsibility is yours, it is immediate, you have to pay out of your pocket at that point in time, there is nobody to pick up the risk and the costs, and hence you try to kind of limit your consumption according to your means. Whereas, in the case of healthcare, due to all those reasons, because you do not have enough information, because there is uncertainty, you do not know the value exactly, and there is somebody else to take up the burden sometimes, the risks, there is somebody else like the insurance company to share your financial responsibility, to share your risk. And since the financial responsibility may not be immediate all the time, there is often a tendency of overconsumption of health care. I will share one small example from my personal life here. So, my husband has seizures, right? In India, we call it epilepsy. I don't know if it is that common. Is that terminology that common here? Okay. So, he had epilepsy. The last time he had an attack of epilepsy was like when he was 18 years old, right? So, long time back. And he has not had any attacks since then, but he is still on medication. He still has to take a medicine every night. And he has seen a doctor, a neurologist here, and he keeps going for his regular checkups every year. And the neurologist has told him several times that we can gradually decrease the dose of your medicine, or we can also take you off medication. So, they have been in a phased manner, they are reducing the dose of his medication, but the neurologist now thinks that he can go off medication, and every time we discuss that whether we should take that step of him going without any medication whatsoever, I feel very skeptical, and I tell him probably you shouldn't do it right now, because we have an important event coming up in our life, you drive a car, we don't stay in the same city. So, there is uncertainty, and maybe due to that there is overconsumption. Maybe he does not need that medication, but he is over consuming it because of all those factors. He has good insurance, so he is not paying out of his pocket. He does not know exactly whether that medication is necessary or not for him at this point in time. There is uncertainty attached to that. So, due to all of that, there is overconsumption right there. Do you see what I am saying? But at the same time, he wants to buy a big whatever, that desktop screen for whatever he is into gaming, so he wants to buy all that. So, I am telling him you don't have to buy it right now, because that is a big expenditure right now. Let us not get into that. So, we know exactly, he knows what is the value attached to him, and we know exactly how much financial responsibility. There is no third party payer who is going to pay for that big resolution whatever desktop. And so the decision is very concrete. There is self rationing taking place there. We are trying to ration ourselves from the consumption of that good. So, do you see the difference between the two? So, there often in case of health care there tends to be overconsumption, whereas in case of other goods there is often self rationing, because all of that is more certain, it is more deterministic, whereas there is uncertainty and lack of information attached. Okay. Now, you could also think, now what do you think this will lead to in terms of elasticity? These are the reasons that kind of triggers inelastic demand for health care, whereas elastic demand for other goods. So, these are also the reasons that leads to an inelastic demand for health care, and these are the reasons that you have a relatively more elastic demand for any other consumption good. Now, the last point, which is of maximum importance. So, coming to the last point, getting back here, once again the difference between free market and the healthcare market, the last difference is, so if you remember where we started with the demand for healthcare, we said that quantity demanded depends on price and non-price factors, right, and that is true for any other commodity also. And in case of healthcare, we said that those factors could be divided into other categories, right, economic, non-economic, and now in economic you had price and income and so on and so forth. In case of non-economic, you had those lifestyle and demographic and profile. Remember, we had those 5 categories, right. Now, we are saying that in case of non-price factors, unlike any other good, here in case of healthcare, you also have some supplier side factors, and this is not true in the case of the demand of any other goods. Supplier side factors. in the healthcare market or for the demand for healthcare. You have some supplier side factors. What do I mean by supplier side factors? By suppliers, I mean the providers of healthcare. So, some factors or some attributes of the providers is able to kind of affect the demand for healthcare. And in that sense, the demand for healthcare or the demand in the healthcare market, let's say, demand in healthcare market is an induced demand. That means these supplier side factors are inducing the demand for the healthcare good in the market for healthcare in many cases. And there is a lot of empirical proof, there is lot of research which has been done on this in healthcare economics, and it has been empirically established that this is indeed true, that suppliers or providers are able to induce the demand for healthcare for consumers. Now, what am I trying to say? What am I trying to say in case of empirical studies? In case of empirical studies, it has been observed, for example, in children, the tonsil surgery, tonsils are taken out. In certain areas in United States, in similar sized cities with similar demographics, one city has very large incidence of those tonsillitis operations than other cities with same demography, same population size, and maybe in the same part of the country, that city may have less incidence of tonsil surgeries. So, researchers went into that, they looked deeper and said what is the difference, and they found that maybe in one city everything else staying the same, all other factors staying the same on the patient size, the factor which was different was probably in one of the cities there were more internists, there were more doctors carrying out those surgeries than in another city. In one city there was a higher density of doctors, physicians who was carrying out those surgeries, while in the other cities there was a lower density of the doctors. Similar studies have also been done for cardiovascular diseases. For cardiovascular diseases, it has been found that in areas where there are more cardiovascular surgeons, heart surgeons, there are more surgeries where the stent, the stent is inserted. When you have a block in the heart, the stent surgeries, those are what is that called, angioplasty maybe. The angioplasty surgeries are more common in certain cities than in other cities where before the surgery there is exactly the same rate of incidence of the cardiovascular disease. But in some places the number of surgeries are more than in the other place, which is similar in all other aspects. So, that kind of concluded to the fact that led to the conclusion that sometimes the demand for certain healthcare services and goods are induced by these suppliers or these providers. Why? Because of the payment system. Because of the payment system. Because even if there is cost sharing, even if there is a third party, remember whoever picks up the burden is not important, whether the patient is paying out of pocket entirely or the insurance company is paying out of the pocket, the revenue is going into the pocket of the provider, right, the hospital or the doctor. So, for the provider it is a revenue grab. If they can induce more demand, then that is a revenue grab for the provider. So, the provider has every incentive to induce more demand. Do you see what I am trying to say? Okay. Now, what does that mean in terms of your demand and supply diagram? And I will end class with this one today. So, you have your healthcare services, let us say whatever, let us say surgeries, services of a surgeon, right, not surgeries, services of a surgeon. Or let us say surgery services. So, we are just making it more it's giving it a more universal kind of approach, not making it a specific commodity. So, you have a demand, you have a supply, like always, you have a equilibrium in the market, you have the equilibrium quantity, you have the equilibrium price. Okay. Now, on the supply side, the example that I was giving you from the research side, if one of the places has an increased number of providers, that is a supply side factor, right? Increase in the number of providers, that is number of sellers, correct? So, the supply curve should move to the right because of more number of, remember we are comparing two cities, everything else is the same in the two cities, the incidence of the disease is the same, the demographic profile of the population is the same, the population in general is the same, so everything else is the same. The only difference is in one of the cities you have more providers. Okay? So, that should take the supply curve to the right, correct. As a result of that, you should have an equilibrium here, as a result of which the quantity will go up, the equilibrium price in the market will go down. Now, this will be true only if there is an increase in the number of suppliers and there is no other change. But in the case of healthcare, now that would be true if this was an ice cream market. If there was increase in the number of ice cream sellers, there would be an increase in the number of sellers, the equilibrium quantity would go up in the market, more people would be buying ice creams, getting ice creams, and they would be buying the ice cream for a cheaper price. That would be happening for any other free market. But in this market, this supply increase just does not become complete at that point. This supply increase is able to induce a higher demand. When there are more surgeons, that leads to this increase in supply is simultaneously accompanied by an increase in demand, and that increase in demand is what we are calling as the induced demand. In case of the healthcare market, always whenever there is an increase in supply, there is always a simultaneous increase in the demand. This has been observed. But that is not true for other markets. For other markets, for any other free market, there is just increase in supply which takes the equilibrium quantity up and that takes the equilibrium price down. So, increase in supply is accompanied by a lowering of the prices, right? And due to the lowering of the prices, since the price is going down, on the demand side, you know there will be a downward movement along the demand curve, as a result of which, you know, quantity demanded may go up. So, there is no shift of the demand curve, but there is a movement along the demand curve. So, the law of demand may be in operation, and this is what I am talking about, the free market. So, people will start buying more, but eventually if the supply keeps increasing and increasing and increasing, there will be a point in time where the suppliers want to give away the product for free, but even then people are not buying it. There will be a point like that, because you know that this free market is also a competitive market. What do I mean by a competitive market? There is competition among the sellers and there is competition among the buyers. So, if the number of sellers increases, then each seller will try to bid the price down to sell his good. This is not, we are talking in terms of the increase in supply because there are more surgeons in the market. The number of sellers have gone up. So, consider a situation where there are not enough people needing surgeries, but there are more surgeons who are performing that surgery. What would happen? There is competition among the surgeons, correct? Because healthcare market is also a competitive market. So, as a surgeon, if you have to have your services sold, you have to lower your price, because there are not enough patients seeking the surgery. So, if you have to have enough patients, you must bid the price of your surgery down. That is true in any market, right? If I am a seller of ice creams and there are more competing sellers of ice creams available in the market, then, and there are not enough buyers, then I have to compete with the other sellers and I have to bid the price down to ensure that my good gets sold. Right? That is what we have when there is a surplus. When there is a surplus, you have to ensure that the price goes down so that you can sell your good. but let us say the number of buyers is not increasing. Then if the supply goes on increasing over time, there will be a point in time when the price has been bid down and down and down, but no matter how low the price goes, there are not buyers of that. And there will be a point where you may be wanting to give away the services for free, but there are no buyers. Correct? So what I am trying to say is that in a free market where there is an increase in supply, there will be an increase in the quantity, equilibrium quantity in the market, and there will be decrease in price. That will initially take the quantity demanded up, but after that there will be no demand whatsoever for that, because everybody who needed the good has got the good, right? But not so in the case of healthcare market. What I am trying to say is that in the healthcare market, it does not stop here. The picture does not stop with this. The physician, for his own interest, he will make sure that he has more patients. They are able to induce the patients because of all those characteristics that we went through: uncertainty, lack of information, and this is also known as the principal agent problem. Principal agent problem. What is that principal agent problem? The principal agent problem means that there is information asymmetry. Both people, the supplier and the buyer, do not have the same amount of information. There is information asymmetry between the two groups. The physician has more information about your health condition than yourself. So you tend to believe, you have immense trust on the physician, and you cannot neglect what the physician tells you. And the physician takes advantage of that information asymmetry to induce that demand, because like you said, this situation is not beneficial for the physician. He does not want to bid his price down. So he wants to make sure that this situation does not happen, and to make sure of that, he will induce a higher demand simultaneously by informing the patients that you need a surgery even when he does not. Do you see what I am saying? Now when that happens, you know from your simultaneous shifts that this will take quantity up and the price down, whereas higher demand, can all of you see? Higher demand will take the quantity up and it will also take the price up. So what has happened? In the market, you have more people seeking surgeries for sure, right? In the market, you have more people seeking surgeries for sure. The equilibrium quantity in the market has gone up for sure, but the equilibrium price is indeterminate, isn't it? But once again, it has been empirically noted that this demand increase is much greater than this supply increase. So the induced demand is much higher, which means that the extent of the shift of the demand curve is much higher. That's a larger rightward shift than that shift, than the supply shift. Okay? And hence you have an equilibrium at E double dash where you not only have a higher equilibrium quantity, but you also have a higher equilibrium price, much higher than the initial equilibrium. So that's why the physicians will induce the demand, because they know that due to that information asymmetry, they will be able to induce a higher demand than the supply. Those few extra physicians in one city will be able to create a much bigger demand in that city.